Thank you all for joining today's lecture on the exciting field of medical nanotechnology and its application in gene therapy. In this lecture, we will delve into various topics related to the use of nanotechnology in the field of gene therapy, exploring concepts such as nanoparticle mediated targeted gene delivery, surface engineering of nanoparticles for gene therapy, nanoscale gene editing technologies, real-time gene expression monitoring with nanosensors, advanced controlled release systems for gene therapy, targeted nanocarriers in cancer gene therapy, precision gene silencing using nanotechnology, nanoscale imaging in gene therapy, nanobiosensors for gene therapy monitoring, regulatory and safety considerations in nanomedicine, nanotechnology and personalized gene therapy, and future perspectives in nanotechnology-driven gene therapy. Nanoparticle-mediated targeted gene delivery is a cutting-edge technique in gene therapy that enables the precise delivery of therapeutic genes to targeted cells or tissues. This approach utilizes nanoparticles as carriers to protect and transport the therapeutic genes to the desired location. The nanoparticles can be engineered to specifically target certain cell types through the incorporation of ligands or antibodies on their surface. The size, composition, and surface charge of the nanoparticles play crucial roles in ensuring effective gene delivery and minimizing off-target effects. Through nanoparticle-mediated targeted gene delivery, we can enhance the efficiency and specificity of gene therapy, paving the way for more successful treatment outcomes. Surface engineering of nanoparticles is a crucial step in optimizing their performance as gene delivery vehicles. By modifying the surface properties of nanoparticles, we can improve their stability, biocompatibility, cellular uptake, and target specificity. Surface modifications can be achieved through various strategies such as coating with biocompatible materials, functionalization with targeting ligands, or incorporation of protective layers. These alterations enhance the interaction of nanoparticles with biological components, increase their circulation time in the body, and enable site-specific delivery of therapeutic genes. Surface engineering plays a pivotal role in maximizing the efficiency and safety of gene therapy using nanoparticles. Nanoscale gene editing technologies have revolutionized the field of gene therapy by providing precise tools for manipulating genetic material. One of the most prominent nanoscale gene editing techniques is the clustered regularly interspaced short palindromic repeats, CRISPR, associated system. CRISPR-Cas9, for instance, enables the targeted modification or deletion of specific genes within a cell's genome. Through the use of guide RNA and the Cas9 nuclease, DNA sequences can be precisely edited, providing immense potential for treating genetic disorders. Furthermore, numerous advancements in nanocarrier technologies have facilitated the efficient delivery of CRISPR-Cas9 components to target cells, significantly enhancing the prospects of clinical translation. Real-time gene expression monitoring using nanosensors has transformed the way we understand and evaluate gene therapy outcomes. These nanosensors are designed to detect and quantify the expression levels of specific genes within living cells or tissues. They can be engineered to respond to changes in gene expression by emitting signals that can be measured and analyzed. Nanosensors can provide valuable insights into the effectiveness and kinetics of gene therapy interventions, allowing for timely adjustments to treatment protocols. With the ability to monitor gene expression in real time, researchers and clinicians gain a deeper understanding of the therapeutic effects and potential side effects of gene therapy. Advanced controlled release systems have emerged as key players in gene therapy, enabling sustained and localized delivery of therapeutic genes. These systems are designed to release the therapeutic payload in a controlled manner, ensuring a consistent concentration of therapeutic genes over an extended period. The release kinetics can be modulated using various mechanisms, such as stimuli-responsive materials, biodegradable polymers, or external triggers like light or magnetic fields. The utilization of advanced controlled release systems enhances the therapeutic efficacy of gene therapy, reduces systemic toxicity, and minimizes the frequency of treatment administration. Targeted nanocarriers have revolutionized the field of cancer gene therapy by enabling site-specific delivery of therapeutic genes to tumor cells. These nanocarriers can be functionalized with ligands or antibodies that specifically recognize tumor-associated biomarkers. By exploiting the enhanced permeability and retention effect exhibited by tumors, targeted nanocarriers accumulate preferentially in cancerous tissues, minimizing the exposure of healthy cells to therapeutic agents. This targeted approach enhances treatment efficiency while reducing systemic side effects. The ability to exploit specific molecular markers on tumor cells using targeted nanocarriers holds promise in combating various types of cancer. Precision gene silencing techniques using nanotechnology offer a powerful approach for addressing diseases caused by the overexpression of specific genes. One such technique involves the use of small interfering RNA, siRNA, which can specifically bind to and silence the messenger RNA, mRNA, of the target gene. Nanoparticles can be utilized to protect and deliver certain molecules to target cells, enabling efficient and precise gene silencing. By selectively silencing disease-associated genes, nanotechnology-based gene therapy holds the potential to treat a wide range of genetic disorders and could revolutionize the field of precision medicine. Nanoscale imaging techniques play a critical role in visualizing and assessing the dynamics of gene therapy interventions. These imaging technologies, such as fluorescence microscopy, magnetic resonance imaging, MRI, and positron emission tomography, PET, can provide valuable information on the distribution, cellular uptake, and biodistribution of gene therapy vectors. Nanoparticles can be engineered to incorporate imaging agents, allowing for real-time monitoring of their behavior in living organisms. Nanoscale imaging enables researchers and clinicians to optimize gene delivery strategies, evaluate treatment efficacy, and gain insights into the biological processes underlying gene therapy. Nanobiosensors have emerged as versatile tools for monitoring and assessing the status of gene therapy interventions. These sensors are designed to detect specific biomolecules or changes in cellular behavior associated with gene therapy. Nanobiosensors can be utilized to monitor gene expression levels, detect the presence of therapeutic genes, measure cellular responses, and assess treatment efficacy. The integration of nanomaterials and biological receptors enhances the sensitivity, selectivity, and functionality of these biosensors, providing valuable information for optimizing gene therapy protocols and enabling personalized treatment approaches. Regulatory and safety considerations play a pivotal role in the development and translation of nanomedicine in the context of gene therapy. Due to the unique properties and characteristics of nanoparticles, careful evaluation of their safety profile is essential. Regulatory frameworks ensure that nanomedicine products meet stringent safety and efficacy standards before they can be used in clinical settings. During preclinical and clinical stages, comprehensive toxicity studies and risk assessments must be conducted to identify potential adverse effects associated with nanoparticles used in gene therapy. Close collaboration between researchers, regulatory agencies, and healthcare professionals is essential to ensure the safe implementation of nanotechnology in clinical practice. Nanotechnology has the potential to revolutionize personalized medicine by enabling tailored gene therapy approaches. Personalized gene therapy aims to account for individual genetic variations and disease profiles to optimize treatment outcomes. Nanotechnology-based platforms offer the flexibility to design and deliver therapeutic genes according to specific patient requirements. Through the integration of nanoscale delivery systems, targeted gene editing technologies, and personalized diagnostics, the field of nanotechnology is spearheading the development of precision gene therapies that hold promise in addressing a wide range of genetic disorders. The future of nanotechnology-driven gene therapy appears promising, with numerous exciting prospects on the horizon. Continued advancements in nanomaterials, delivery systems, gene editing tools, and imaging modalities hold the potential to further enhance the efficacy and safety of gene therapy interventions. The integration of artificial intelligence, machine learning, and big data analytics may also revolutionize the field by providing predictive models for optimizing treatment protocols and personalized gene therapy approaches. The convergence of nanotechnology with other emerging fields such as biomaterials, regenerative medicine, and immunotherapy will likely unlock new opportunities for tackling complex genetic diseases and improving patient outcomes. In conclusion, medical nanotechnology has introduced revolutionary approaches to gene therapy, enabling precise and targeted interventions for a wide range of genetic disorders. The topics we explored today unveiled the fascinating world of nanoparticle-mediated targeted gene delivery, surface engineering of nanoparticles for gene therapy, nanoscale gene editing technologies, real-time gene expression monitoring, advanced controlled release systems, targeted nanocarriers in cancer gene therapy, precision gene silencing, nanoscale imaging, nanobiosensors for gene therapy monitoring, regulatory and safety considerations, personalized gene therapy, and future perspectives. The combination of nanotechnology with gene therapy holds immense promise for revolutionizing the field of medicine, providing tailored treatments to individuals and improving patient outcomes. As researchers and healthcare professionals, we must continue to push the boundaries of this interdisciplinary field, unraveling the full potential of medical nanotechnology in the realm of gene therapy. Thank you, and I hope this lecture has sparked your interest in this exciting area of research.